First of all, thank you so much for giving me the opportunity to be here today. My name is and I go by. I was born in Poland and I moved to with my parents and my sister almost 15 years ago. And since then, has become my second hometown. Since a young age, I always enjoyed science classes. And when we moved here to I helped my parents and my grandparents with their medical appointments. I translated for them. And I thought to myself then that I wanted a career that could blend science and with the opportunity to helping others. But my path to nursing wasn't straight. I got my degree in molecular biology in 2019, which I truly enjoyed. But however, as much as I enjoyed that scientific part of the field, I missed interaction with people. So after I graduated, I got my job as a medical assistant with a Polish primary care doctor. And that was almost 6 years ago, and it has become my job and my passion. I love building relationship with our patients and helping them during their healthcare journey. And then when the pandemic hit, my sister, a wound care nurse, she continued to work and I was truly inspired by her stories. She was so determined to help those patients. And I shadowed her multiple times and I decided that was the pathway I wanted to pursue. And I went back to school, got my degree in master's in nursing last year. I graduated last year in 2024 in November. And I think that was one of the best decisions of my life. Already met people who I could help, and they made me a better person. So I'm looking forward to starting my new career as a nurse.
The only part I didn't like was that like you've already met people you can help and they made you a better person. That part to me
Yeah.
seemed a little bit cheesy.
Okay, so
Um,
let's
but
yes.
then we have to talk about the last two bits. It was way better, by the way. You need to smile though. You gotta like aim to smile like three times every answer
Okay.
because there's something that happens where you're looking at the candidate and you're like, if I was a person like scared in a bed and I saw this face come into my view,
Mm-hmm.
like would I feel like this person was warm and cared about me? You know, they're
Mm-hmm.
kind of picture how are you with your patients. That's why I think you should
Smile.
smile.
Mm-hmm.
Yeah.
Okay.
Try aim for like three genuine smiles every answer where it fits it, where it's not weird, you know? And then, okay, so the last two parts that we need, it's going to be different for different
Mm-hmm.
interviews. The part where you talk about, so this interview today, it's for what?
That's for observational unit next to emergency room.
What's the hospital? And you did your preceptorship in the emergency department.
Yes, emergency room.
Yeah, so I would talk about how much you loved your preceptorship in the emergency department.
Even if it's like a different unit.
Because it's adjacent to, it's part of it's like the people in the emergency room who need a bed but haven't gotten a bed yet and they don't know, do we even need to admit them to the floor or maybe they can go home tomorrow
Mm-hmm.
and just, this little group of nurses can just watch them. But it's going to be all the people who came from the emergency department anyways. At the end of everything that you said, you're going to talk about how you really enjoyed the emergency room and talk about why, genuinely. And then so I was really excited to see that you had a position open for the observational unit because I think that'll be a really great opportunity to learn about, I think I'll get the same kind of variety that I would get with the emergency department, but it'll be a really good opportunity to develop my skills for patients that may have a longer admission or that may need to stay overnight for observation. Something that makes it sound like
Mm-hmm.
it's not only emergency department, like you're excited about the skills that you'll develop. Develop really good assessment skills, learn how to monitor a patient overnight and escalate any concerns, and develop really strong teamwork and relationships with the interdisciplinary team. I don't know. I don't want them to think, oh, she doesn't understand. She thinks this is for emergency department. She's not going to like observation. You got to make it sound like you're excited about the observation because you'll get a lot of the same types of patients that you are able to work with in the emergency department where it's a variety, but it'll be a good unit to develop your skills for patients that stay overnight and how to
Monitor the like
monitor.
make
Yeah,
like a comprehensive because I like the unit because I think I will have the opportunity to have similar cases to ER. No, maybe not.
I'll have the opportunity to have patients with a variety of conditions, which is what I loved about my preceptorship. But I'll also get the opportunity to develop my skills with monitoring a patient overnight and giving them comprehensive care, making sure they have a safe discharge, have really strong assessment skills, and work with the team. I think it'll be a really great opportunity. And then you have to talk about what you know about the hospital, why you think it's a great opportunity for training a new graduate. Like what do you know about their program where you're like, oh, that could be good, you know?
Their mission is to treat patients in a holistic way.
Okay. They have a nursing professional governance where nurses are engaged and empowered through shared decision making to influence practice, professional development, and research. Oh, you could say that. You could say, because they have a research background, I'm really curious about evidence-based care, and I see that it has a nursing professional governance that lets nurses be engaged in evidence-based care to improve practice.
So it's like those quality improvement projects, something like that.
I don't know. I would say I was also really excited when I heard back from because they're known for the educational opportunities they provide nurses, particularly the nursing professional governance. And I understand that that would be an opportunity where I could continue the curiosity that I had initially in my research career, but use that to be engaged with improving practice and learning about the latest evidence-based practice. They're gonna like that. Oh, they talk about the residency program here. You could say, I also am really excited about because you are known for an incredibly supportive new grad training program, including interactive learning sessions, case studies, and simulations. It just sounds like an incredibly supportive learning environment for a new grad to learn how to provide really good outcomes. So I'm really grateful to be given an opportunity to meet with you, would be the phrasing that I would probably use. So allows nurses to be engaged in developing evidence-based practice. And that was really interesting to me. I was really drawn towards that because my initial career was in research, but I wanted the human aspect to my day-to-day job. It's going to make you sound so smart and sciencey. They're going to be like, wow, this one's a little genius. Leader. And then when you're talking about the new grad program, you could say, I'm also really excited about the things that I've heard about the new grad program. It sounds
Mhm.
like there are so many opportunities from simulation labs to classes.
Yeah, how about if I say also that in the emergency room, I had a chance to be a part of this webinar where nurses, led by nurses, who talked about those quality improvement projects. And the project was about steps, what should be taken by each nurse to decrease contamination of blood cultures. Could I mention that or just too much about this opportunity to engage in developing evidence-based practice?
Well, maybe you could say, for example, during my preceptorship, I got an
Mhm.
opportunity to participate in a quality improvement project, reducing contamination while drawing blood cultures to improve accuracy. And I found that really interesting to be
And
able
I
to use.
also read on your website that you encourage nurses and give nurses the opportunity to participate, to engage in developing new evidence-based practices, and that made me excited.
Yeah, and you can say, I really enjoyed research in my first career, but it was missing that human aspect that nursing provides. So I'm excited about being able to still use those skills to help patients. And so I'm really grateful that you've allowed me to come meet with you today and just end it on that kind of like thank you vibe, maybe. Okay,
Mhm.
so
And he asked me this question when I was like, oh my God, tell me a story when you saw someone stretching the rules and how did you react? I
mm,
was thinking about this question, and I had recently story when our patient, established patient, called our clinic, and he was like, "Oh, I'm sick. I want to make an appointment. I'm coughing, and I have a cold." And he didn't seem to be sick. And I asked him, "Oh, you don't seem to be sick." And he was like, "Oh, okay, this is for my girlfriend, the medication. His girlfriend is not our patient."
he called and he said, I'm really sick. And you were like, oh, and I've been coughing. And you said, oh, I'm not hearing any of that. Can you tell me a little bit more? And he said, okay, well, here's the deal. It's not actually me, it's my girlfriend. And I'm worried that it'll take too long to get her an appointment. She's really sick. I'm really worried about her. Just trying to help her. I need you to make an appointment for me. I will pretend to be sick to the doctor and he will give me medication and I'll give it to her. And you said, for safety, the doctor really needs to assess her. If you have her schedule available, I will help you make an appointment for her and the doctor can assess her and find treatment that's going to help her. Here's our next available appointment. Does that work? And he was really grateful. But you knew it wasn't appropriate or safe for you to help him, you know.
The way he wanted to solve
Yeah.
the problem.
Yeah,
Mhm.
you could do that.
So this would be good. The story would be good for this question. Tell me when someone stretched the rules.
Yeah. I've gotten a lot of great feedback from you guys about the questions list with the 72 questions. You guys can get that for $3, by the way, with your discount code YouTube. And I wanted to build something for you where you can build out your answers on your phone that's really easily accessible. There's 33 of the most common questions that I put into a Notion template. If you don't use Notion yet, you should check it out. It's a really cool app similar to the Notes app, but it's very customizable. You can add pictures to it, you can change the colors, make it look how you want it. For each question, you get guidance on things to include, things to avoid talking about, example answers, and then there's embedded YouTube videos where you can watch other new grads give their example answers. And there's a notes section where you can type into and save your draft of your answer and start building your answers when you're waiting for the bus, or you're waiting for post conference to start, or you're in the kitchen cooking pasta and waiting for the water to boil, or just whenever something comes to you, you can just put it right in your phone in a way that's super easy to go through. You can also use the Notion app on your computer browser, you can use it on a tablet, but I wanted something for you where you can just little bit by little bit, or over the course of a night, if you have an interview tomorrow, start building out your answers in a way that's easy to break down with a lot of examples to help jog your memory for examples from your clinicals that you may have forgotten about. This is just a very streamlined way to start throwing in ideas and how to build out your answer in a way that's going to be very easily accessible on your phone. The difficult patient story. What do we have for that?
We have for that story about a husband and one a wife who came to, and the guy was very much in pain. And his wife was, her demeanor was very demanding and not cooperative. We came to the room and then the wife was like, "Oh, he's in so much pain. Why we had to wait so much? No, I want to see doctor right now. Not you, not nurses, doctor right now." And I stepped back and tried to relax and calm down. And I was very polite to her and tried to tell her that taking his medical history is very important. We need to know about his allergies and his chronic conditions, and we really need to do our comprehensive assessment so we know how to treat him and what kind of care he needs. And the wife calmed down and she started telling us his medical history because he hadn't been to that ever. So he told us about his medical story, about his allergies, current medications, all of this stuff. And he calmed down. Doctor came. It turned out the patient had, and she calmed down and she actually thanked us and said, "Okay, I'm sorry. And thank you so much for your hard work. And I'm sorry for my behavior, which was understandable, but she was just didn't know the whole situation, and not knowing things sometimes leads to frustration."
Okay. I like it. We got to change it a little bit. The most important thing I wanted to remember to tell you is when you're saying what she said, don't use a different voice.
Mm-hmm.
Use
Yeah, I listened to one of your, yes.
just do it in your own voice. And
Mm-hmm.
I would say something like, yes, a time that I had a difficult patient was during my preceptorship there was a couple that came in and the wife was verbally aggressive. And I'm not going to repeat the swear words that she said, but the things that she was expressing in a very demanding way was, I don't want to see a nurse. We need to see the doctor right now. This is an emergency. He's here. I don't want to see anyone else, only the doctor
Mm-hmm.
immediately. And so I realized she wasn't trying to give me a hard time. She was just really scared and she wanted to help immediately. She felt a sense of urgency. So what I decided to do was take a step back so that I could be calm and polite. And then I tried to see what I could do to help her fear. So I said, absolutely, I'm going to see what I can do to help expedite having the doctor come speak with your husband.
Mm-hmm.
In order for me to do that, the doctor is going to expect that I've done a thorough intake, and I would like to ask for your help in helping me gather this information that the doctor is going to need. Is it okay if I start collecting that information for the doctor right now? And she said yes. And so I started asking questions, and both but the patient was in a lot of pain, so it was easier for the wife to give some of this information. So she started helping giving the information and clarifying everything. And I said, this has been really helpful. I'm glad that you are here. Thank you so much for helping me gather all of this information. I'm going to now go see what I can do to expedite the doctor coming in to speak with you. If anything changes, here's your call light. Let us know right away if anything concerning happens in the meantime. But I'm going to go see what I can do to get the doctor in here as quickly as I possibly can. And she actually stopped me as I was leaving the room and said, I'm so sorry. And just thank you. And you said,
Right.
no problem. I understand this is concerning and you're just trying to help. And I'm really appreciative for all the information that you're able to give us. And if anything happens, let us know. Okay. We'll be here and the doctor will be here soon. Yeah. Okay. It's basically the same as what you said, just like a little bit more like, because you want her to walk away thinking, I did a good job. I helped. It's good that I was here because I was so helpful, right? Instead of walking away thinking that nurse thinks I'm terrible. I did a bad job, right? You want her to think like, okay, I helped. I did good. I fixed this, right?
Mm-hmm.
That's all they want. And you can say that. You can say, I've noticed when patients or family members are upset, oftentimes they're just trying to help in the best way that they know how. And maybe they're scared. Maybe they don't feel heard. Maybe they're uncomfortable. I think for this wife, she felt so terrible seeing him in pain and not being able to fix it that she just felt this sense of urgency of like, I need to get him help now. And
Mm-hmm.
very fearful. So once we addressed that, she was much more cooperative. Next, probably most common one is tell us about a time you provided compassionate care. Again, it's the same probably story as like above and beyond, or a time you demonstrated our hospital values in, whatever.
So
Empathy and that.
we said the story about this above and beyond about the about parents who came with their child who was less than a year old. The child fell down from a dad was with the baby and he put the baby in a and the baby fell down face down. Mom wasn't at home and they rushed to the and I saw those parents, they were terrified, especially because the hospital had to report the incident because the baby was less than. year old, and I saw how much they struggled with fear and guilt. And I took some extra time and I sat with the parents, took some time and to listen to their concerns and provided them with emotional support. And it turned out the baby had a broken and had to be transferred. But as they were leaving, the father, especially, he also said, "Thank you so much for listening to our story, for making us feel better." And it like made me realize that taking care of patients in a holistic way, not only like physically, but take care of their emotional needs as well, is part of healing, and they just needed some empathy.
Yeah. By the way, you can also use sometimes hospitals ask this weird question where they were like, tell me about a time when you noticed a prejudice or a bias in your care and how you fixed it,
What
right?
did
So
it
you
do?
could say,
Mhm.
I know a lot of people have very strong emotional reactions, understandably, to, if they have to care for a patient who is abusing a child or who is racist or maybe has committed a crime, like a violent crime. It can be very difficult for nurses to have compassion towards that person. And I realized in that moment that regardless of my opinion of what happened with the accident with the baby, my job is to provide compassion, to provide resources, to provide support. It'll be obviously the court's decision to, the a legal decision that I won't be involved in of what changes need to happen in the home. But my job is to provide the safest care possible for this baby and then to see what I can do to help with this really palpable fear and terror and guilt that is you can feel in the room overwhelming these two parents. So I decided to just listen and provide resources and support the best that I can.
Mhm.
But yeah, you can use that for like the prejudice, biased, whatever kind of thing, right? Or a time it was difficult to provide care to a patient because of their beliefs. Maybe you could do that. But, anyways, this one with compassionate care. So, when you're telling the story, you could say, our care was very much focused on getting this baby assessed, evaluated, treated. But I could tell that there was so much fear and so much guilt happening. You could feel it in the room with these parents. So, in addition to caring for the baby, I decided to just spend a couple minutes letting them say everything that they needed to say about what had happened. And, while I couldn't make any promises about what may or may need to happen in the home, I was able to provide them support and resources that were going to help them because this was such a traumatic experience for them. And I realized compassionate care isn't like these big grand gestures. Sometimes it's just as simple as listening for a few minutes because that's what they
Mhm.
really needed in that moment. They needed someone to hear their version of the story and help process this traumatic event with them.
Mhm.
Okay. What about the mistake one? The time you made a mistake?
A time you made a mistake. So we had the situation when it was very, very early on. I started my first job as a medical assistant. I came in to work and there was already the waiting area was already very busy and doctor told me quickly, like told me a few things that I should do. One of them was to call and schedule an appointment for our patient to do a CT because our patients sometimes often don't speak English and they need our help to schedule their appointments. So I called that place, the radiology place. I scheduled that appointment for our patient and called the patient to let the patient know about the date and time. And the patient was surprised. He told me like, "Oh, I only wanted the doctor to refill my prescriptions to call the pharmacy." And I got confused and went to the doctor to double check. It turned out I scheduled an appointment for a wrong patient. And I called the patient back and apologized and rescheduled that appointment for another patient. And since then, I have always written down all the things doctor tells me to do and to ensure the accuracy and always repeat back his orders to avoid any mistakes.
I like it. And then say the extra part too about how this was incredibly embarrassing as a mistake for me. You know, that this happened in front of the patient and the doctor. But I realized very early on in my career that having closed loop communication is super important. For example, if I was in a code blue and the doctor says, give 1 milligram epi, I'm going to say, instead of I got it or something vague like that, I'm going to say, I have 1 milligram epi. Is that correct? And ensure that I heard correctly because sometimes in an emergency, the doctor won't put in a written order in the computer. And it's so important to make sure that there's no miscommunication with the closed loop communication. So I started doing that back when I was a
Mhm.
medical assistant, and it's really helped me make sure nothing like this ever happened again.
To help me like during my clinicals,
Yeah.
something like that.
Yeah. And it'll help me in the future too, because I saw how easy it is for verbal communication to be misunderstood. That closed loop
Especially, yeah.
communication
Mhm.
has made things a lot safer. If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
One of my strengths is compassion, very important. Sometimes it might be only like small thing like listening to the patient, but it allows nurses to care for their patients in a holistic way, listen to their not only physical but emotional needs. I was always curious during my clinical rotations. Always when I started my shift, I did comprehensive assessment on my patient at the beginning of each shift to have a picture of the baseline of the patient, and that helped me during the shift to identify changes and act quickly and to implement interventions in a timely manner. And also self-awareness, maybe
Yeah, you can say changes from baseline, maybe would be.
changes from baseline.
Yeah,
Okay.
yeah.
So, and I would say self-awareness because I'm open to feedback. I really like feedback because it makes me a better nurse and I want to be the best nurse possible. And I don't take feedback personally, but rather learn from it. And it's a very valuable tool to grow and enhance my skills.
And the weakness, don't forget the weakness.
Okay, so weakness, I would say a weakness is my lack of experience. It's challenging to come from a career, come from like a work that I've been doing for the last 6 years and starting a new career with limited experience. However, the path really excites me and I'm trying to take day by day and give myself permission to be new. I also try to practice self-compassion.
I would frame it more as
Mm-hmm.
a weakness that I have that I'm working on is that I lack experience and self-compassion. So in my past career, I had 6 years of experience, so I could be helpful when new employees would come to me with questions. I'd be able to help train them and be sort of in a mentor role. And as a nurse, I'm a student and I still have so much to learn. And I feel like I'm starting over at square one again, which has been new and difficult for me because I see these nurses that I respect who seem to know what to do in any situation. And I want to be like that today. But I know it's going to take time. That those nurses that I look up to, they went to nursing school too, that everyone has to start at the beginning. And I've learned I need to just be patient with myself, that it's okay to be new. And I've found, especially in my preceptorship, if there's something that I'm unfamiliar with, people have been really kind to me when I say, for example, I haven't put in an NG tube before. Can you show me how to find the policy and procedure? And then I familiarize myself with that. And then when they have a patient who needs an NG tube, they come find me and they say, I know you said you've never done an NG tube before.
Mm-hmm.
The other nurse has a patient that needs an NG tube. Do you want to go with them? And I found if I'm open with things that are weak areas for me, people have been really kind in helping me get stronger in those areas. So I've just been seeking out mentors and just trying to be patient with myself through the process. And someday I would really like to have a nursing student or train a new nurse as a preceptor the way that I used to be able to be helpful as a medical assistant. Someday I want to get there, but in the meantime, I just need to be patient with myself through the process.
Mm-hmm. Okay,
Yeah.
I'm working on it. Mm-hmm.
Yeah.
Weakness that I'm working on it.
Yeah. Yeah. What if they say, do you want day shift or night shift?
I'd rather have day shift, but I understand I'm new and probably night shift is the only option right now. But I say I have no preference.
Yeah, just say you have no preference, you'd be super helpful for either. You have a slight preference for day shift because you think it'll be
Mm-hmm.
a really great learning opportunity to work more closely with the
Sure.
interdisciplinary team, but you'd be really grateful for either opportunity. Yeah. And then
Mm-hmm.
once you get all your offers, you can kind of pick and choose, right? You just tell them you have no preference and then you see what happens. I really like this painting behind you.
Oh, thank you.
It's so like lovely and like just ethereal. Anyways, okay. I keep staring at it. It's making me like calm. Yeah.
Nice.
What if they ask you? So this one is different than the mistake question. The mistake one is that like you took ownership, you made changes going forward. So that mistake, that kind of mistake is impossible now because you have this new system, right? The feedback one, what do we decide for the feedback one? Basically, you're just saying like, I love feedback. Here's the time that I loved feedback. Also, I love feedback.
All right, so yeah, I love feedback.
Was it something about the phlebotomy? Something about,
Yes.
yeah,
Mm-hmm.
yeah.
I love feedback and makes me that's a key to grow into the best nurse I can be. I have a certificate as a phlebotomist. I was comfortable drawing blood, but I hadn't had many opportunities to practice putting in IVs until I started my final rotation in the and I was so fortunate. My preceptor was known for his special skills and could always put in an IV even in the most difficult heart stick patients. So he shared some techniques with me. He gave me feedback. Like one of the technique was like to when he saw superficial veins, he slightly bended the needle and then inserted the IV. That was very helpful with those superficial needles. He taught me how to use vein finder, how to palpate the veins to check how the direction of the vein and to check for valves so I could avoid hitting the valve. He also emphasized that it's okay to take more time. Don't rush because it's better to take more time and then poke the patient twice to find the good one. And that was very helpful. And he really helped me. And I got better with putting in IVs. He gave me many opportunities to practice and he was proud of my improvement and he even mentioned that in my final evaluation and that I made a significant progress in that area. I was very thankful for his feedback because I love feedback.
Yeah, you can say that you're always going to think of him every time you put in an IV and how grateful you are. Yeah, yeah, yeah. Okay, cool. Let me start going through the Notion template and see what we're missing. You need to be ready for like, obviously, why do you want to work at this hospital? Why do you want to work on this unit? You can probably think of something, right, for those.
How about if I say it's close to my home? The hospital is 5 minutes from my home. Is it like,
Well, I would say it differently. I would say and I would say it as like a last thing, not the first thing.
okay.
And I would
Mhm.
say one of the things that would make this a really great fit for me is I actually only live about 5 minutes away. So let's say somebody called out and they needed someone to come in last minute to, pick up a shift or to cover breaks. It'd be really easy for me to come in to pick up overtime and things like that.
Hey,
They'll be like, ooh, okay. It's more just the things that you said earlier, like this hospital is known largely for the evidence-based care that they provide, but then also the nursing shared governance, which would give me, like I said, my initial career was in research, and I decided to pursue nursing because research just didn't give me the opportunities in terms of working with people day to day and the opportunities to be compassionate and show empathy. I just wasn't going to get that with my research career. And I saw my sister as a nurse have those opportunities. So I decided to pursue nursing. But if I was able to find an opportunity to use evidence-based practice to help update the policies and procedures or things like that, that would be a super interesting way to utilize the skills that I acquired in my past career to actually help patients in a very hands-on sort of way. I would think that would be a really cool way to bridge my past skills in a new career that's going to be more fulfilling for me. And is the hospital out of all the hospitals that I've read about, that's the one in this area that is known for providing opportunities for nurses to utilize research and evidence-based practice. And then the new grad program sounds incredible. It sounds like there's so many different approaches that will support different types of learning, whether it's hands-on versus classes, simulation labs, discussions. It sounds like the mentorship and training provided through this program is unmatched. And that's really important to me as I'm new, trying to develop really good habits. And then what else? I don't know. Something else that they're very holistic and compassionate in their care. And that has been important to you. That's part of why you wanted your career change is because you want opportunities to do that every day.
and there was also, I had one question. Why did you choose nursing, not like being a doctor? Why nursing, not like go to medical school and get your MD?
Oh. Well, it's just all the stuff that you got to see your sister doing. It wasn't the doctors that were like when you shadowed your sister, you realize the doctors come in for 5 minutes and then they leave. It's the nurses that actually do all of the hands-on skills that spend time listening to the patient, talking to them,
Mhm.
helping them through the really hard days, or like doing the little, bringing the patient their favorite thing that, brightens their day, putting the pictures on the wall of their families, like those little things. It's not the doctors that get to do that. It's the patient or it's the nurses.
Spend more time with patients. They can quickly help deteriorate something like that too, and they can quickly act. Okay, got it.
Why do you want to work on this unit?
So I'd love to work on this unit because I think this unit will give me the opportunity to develop skills for comprehensive assessment because patients are staying overnight. So they come there with variety of conditions. So it will be important to monitor them and to do a comprehensive assessment and to implement interventions when they health deteriorates because it will allow me to give the patients comprehensive care and care for them, monitor their condition.
I would say and work closely with the interdisciplinary team. And then I would talk about how in the emergency department you liked that you got a really wide variety of conditions that affect the community and you got to learn how to care for so many different kinds of patients, that the variety was really interesting for you. You liked how dynamic that was. What about if they ask a time that you provided family-centered care?
Family-centered care.
My favorite answer that people have sometimes is like in their mother baby unit, they got to teach a dad how to change his first diaper or teach him how to swaddle. And he's like, oh my God, I made a burrito. Or like at first he's like scared to touch the baby because he thinks he's going to break it. But then he changes his first diaper. And then the next time he's like, no, 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 I got it. I got it. They taught me how. I'm really good at this. Watch. And he does it. And he's like super proud of himself, you know?
That's actually that's true. We showed the dad how to give a bath to the baby, and
Okay.
he was so scared he couldn't even hold the baby. That was his first baby.
And
I
then
was
after?
scared
That's the before. What's the after? The after is he was like smiling,
after.
really proud of
Yeah, he
himself.
was smiling and hugging the baby and trying to, put the towel on the baby, and he really enjoyed that time.
Yeah. And then
Right.
maybe the next bath, he was able to do a teach back. That's what we call a teach back, where like you show them and then they teach you back and it solidifies their patient education.
Okay, that's a nice one.
Yeah, that he was like really proud of himself and really confident and smiling really big. And it was just a really beautiful moment to be able to have. And when we take care of a patient, we take care of their family as well and their support system. And we always make sure we answer any questions that they have, make sure they have linens if they're going to stay over, make sure they know where the cafeteria is, encourage any questions. Yeah. Okay. And if they say at time a family member was unhappy with your care, you can talk about that wife, right?
Mm-hmm. Don't change your voice. During one of my clinical rotations, I met a patient who just found out he had, and I started talking to him, and he had a cross on his chest, and I started talking to him. And it turned out that he a little in the past, and his health started to deteriorate, started from, and then and he told me, okay, he made a mistake in life, but he didn't do well on the past. Rather, he looked in in the future, and he reunited with God and wanted to go to that was the special place for him. And he asked me if I believe in God, and he said, I said yes, I do. And he asked me if I could pray with him just for a moment. And so we prayed, and
I would say, I would smile when you say we prayed, and you could say, I could see by the change in his mood that the prayer was really helpful for him,
mhm.
providing him with peace and confidence. And I love when patients are willing to share their cultural preferences, whether it be about religion or food or music, really anything, because then we can tailor their care to be more patient-centered.
Mhm. It's important because every patient, yeah, share with cultural beliefs, values. Okay.
Yeah, because it gives you the opportunity to connect more with your patient and make their care more tailored to that specific patient. And then it lets us communicate to the next shift. Just FYI, the patient is religious and it really helps him emotionally. What about where do you see yourself in 1 and 5 years, or what are your short and long-term goals?
So my short-term goal is to get more experience and to get better, get more experience and hands-on practice. And my long-term goal is to become experienced nurse. And I would like to participate in those quality improvement projects in the future. I had a chance to participate in such project in the emergency room. The project was led by nurses and me, and it was about decreasing contamination of blood cultures. And it made me realize how important evidence-based practice is on patient outcomes. So I would love to be a part of such projects, and maybe I would like to also become a mentor. I was so fortunate. I've met nurses who always showed me everything, was very willing to help me, to show me things, and I would like to give back to the community and support new nurses, empower them, and support them during this challenging and sometimes overwhelming transition.
Okay. I mean, you can also say, I'd love to get any unit specific certifications, whether
Hmm.
that be PCCN or get certified in ultrasound guided IVs, whatever would be
Oh, yeah, ultrasound
helpful
guided
for the unit.
IV. Hmm.
Yeah. What about if they say, tell us about a time that you had to act quickly to keep a patient safe? Or like, tell us about a time you had a critical patient.
Mm.
In the emergency room in your preceptorship, did you ever have a rapid response or something where they came in where they were really not stable and you guys had to stabilize them? You know, chest pain, new stroke, all of a sudden needing a lot of oxygen,
It
blood.
was we were assigned to a patient who came in, the guy, his face suddenly, they were out with his girlfriend, they were out, and his face suddenly drooped. And that girlfriend took him to the emergency room. They put him on that alert bed. Doctor came very fast. We had to act very fast, put in fast IV, take him to CT. It turned out it was,
Oh,
yeah.
okay. I would also say we did a very thorough neuro assessment as well, just to see if there's any other focal deficits. So we looked at his pupils. We assessed the facial droop, which was very present. We made sure that he didn't have a pronator drift or weakness on one side. He was able to understand speech and speak. His speech was a little bit slurred because of but there were no other neuro changes. His pupils were reactive, and we also checked his blood sugar. Vital signs were stable. So we quickly established IV access, coordinated with CT to get him quickly to CT, which was negative. But they found out the neurologist evaluated him and they determined that he had. And so while it wasn't it was a really great example of what it looks like to quickly coordinate care within the different departments to help rule out a for a patient. So you could use this for a time that you worked well in a team, a time you had great communication, good collaboration, because you're talking about, maybe you had the nursing assistant go grab the glucometer, you put in the IV while your preceptor called CT and started the code or whatever. Like you can talk about all the different people, the neurologists,
Hey.
yeah.
Mhm.
What about if they say, tell us about a time that you advocated for a patient?
Would I use that story about the nurse who said later, and I
Yeah.
about this urine thing
Yeah.
later, and I advocated for the patient by asking her if I could could ask a technician to go to the room and take the patient to the
Well, it's not
bathroom
just
when
like
he
you're
was.
like telling the technician to do it. You're like, I'm a student, I have time. I really appreciate you taking the time to have a student during your busy med pass. I have time. I can go together with the nursing assistant and we can toilet the patient, get them all cleaned up safely back to bed so that they're ready when you come in with the medications. Does that sound okay? And she was like, oh yeah, 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 yeah. Go.
Mhm, okay.
Yeah. And you can say, sometimes you have to advocate, even as a nursing student, this person had so much more knowledge than me that I felt like maybe it wasn't my place to argue with her, but I'm glad that I found a way to respectfully advocate for the patient in a way that was supportive of her, but also honored what the patient was expressing. Because someday maybe there's a doctor that I'm going to need to advocate to. And I've learned there's always a way to do it where you're being respectful, but also standing up for your patient. What about, if they say at time you use evidence-based practice, you can use what you call it, the thing about the blood cultures. What if they say a time that you had conflicting priorities? Or maybe they can also ask a time you had to delegate. And you can make it like a two for one, right? You had these different competing tasks, and one of the tasks you gave to the nursing assistant, right? Patients asking for ice chips or something. So people talk about maybe they were at the station and they were about to do something, but then the call light went off for for one patient, and then the family member is asking for this other thing, and you decide which one you do first. Or like maybe you got report on all your patients and you're saying like which one you went to first because what reason?
We had that situation once. It was super busy, beyond busy shift. And there were drawers next to each room. There were drawers with all the supply, like to put an IV, etc. And we were like running back and forth with my preceptor, and we didn't have time. The drawers were almost empty. We couldn't find things. We didn't have time to fill the drawers, to go to the supply room and take the stuff and fill the drawers. So we asked one of the technicians to fill the drawers, and it was very helpful because there was so many patients. Shift was super busy, and we needed that stuff very fast.
Okay. Yeah, that would be really good for a time you delegated. What about a time you had conflicting priorities, though?
Conflicting priorities.
Yeah, like you needed to go see two patients, but you decided first, let's do this one just to make sure everything is safe. Then we can go to the other one.
Tray with food came. That was for the diabetic patient. It was time to give him insulin, but at the same time, there was a call light from another patient who had a trach. So I put down the tray, went to see that trach patient. It turned out the patient just wanted to get something from his bag. So I gave him everything, checked oxygen was okay. So I gave him what he wanted from the bag and went back to the patient to give him insulin and food and
So
checked
in the
his
way that you
sugar.
say for the trach patient, you need to say, I went to the trach patient first, just in case, because he couldn't talk, he had to use a marker board. I wanted to make sure he didn't need to be suctioned or, maybe he was trying to say he was having difficulty breathing or something like that. I needed to know what it was that he wanted first, just in case it was something respiratory related. Turned out he just wanted to grab something from his bag, which I was able to help him with really quickly. And then for the diabetic patient whose tray arrived and needed insulin, I knew it was okay to go see him second because on his recent lab, it included glucose and the glucose was stable. So I checked his sugar. Sugar was fine. I gave him the tray and then came right back with the insulin that he needed to go along with his meal. And during that time as well, there was a family member who was asking for ice chips. And I asked the nursing assistant if they had time to help with that. And they said, absolutely no problem. And then you could finish it up by saying, while it was a kind of a busy moment with everything happening at one time, it was just a good learning opportunity for how to prioritize for safety what should happen first, second, and what can be delegated. Let's see. Oh, a time you had a change in the plan of care. Could we somehow make that patient work? Change in the plan of care was like we were thinking it was a, but it turns out it was. So, like, what was the care plan after that? What did they do?
Steroids.
Huh?
He got, they gave him prednisone
Oh, okay.
for the, yeah, for those nerves to
Okay. Okay.
shut down the nerves a little.
Okay.
And I think they let him home,
Yeah.
let him go. Mm-hmm.
Yeah. Okay. You could do that. Can you tell us about your hobbies and self-care?
I have a cat. I really like to spend time with her. She calms me down and relaxes me. And I also like to work out. I recently got myself a Christmas gift, like this home treadmill, and I use it. I watch movies and walk on that treadmill, that walking pad. It's like very relaxing after a long day. It's really relaxing.
Okay. I would also say something that gives a nod to like you understand nursing is hard and you're not like a burnout risk. So maybe something like, I chose to pursue nursing because I wanted a really meaningful career. And part of that is sometimes there are really hard days where patients have hard outcomes. And I have been told by my preceptors that it's really important to have a good self-care plan in place so that I can process those days and grow from them. And I have a really good support system and a good plan of how I like to come back 100% refreshed for the next day. And I've been told that that in the future is going to be really important. And that's all the questions that we have for you. What questions do you have for us before we wrap up?
What advice could you give to a new grad nurse how to not get overwhelmed?
Mm-mm.
No. Okay. That's okay.
It
Advice
makes me
stuff.
think you already know you're going to be overwhelmed and you already know it's going to be like a disaster. Like, no, no, no.
Don't,
You could
okay,
just say, what advice do you have for new grad nurses?
don't use those like strong words. Okay.
Yeah, don't make them think you have issues with time management, getting overwhelmed, working together with people. Like, no concerns. Like, your only weakness you're admitting is that you need to give yourself patience as you are becoming like these preceptors that you want to be like.
And how about if I ask me that question, could I ask him about this professional, nurse professional
Yeah.
governance
Yeah. Can you
program?
tell me more about the shared nursing shared governance? Yeah, that's a good
Governance.
one. You could also ask, can you tell me a little bit more about the patient population that you see on the observational unit?
Oh, patient population. Mm-hmm.
Yeah. If you want to know about like struggles, right, you could say, what have you seen new grads struggle with on this unit and what's been really helpful for them? Because you want to know, like, you want to end it on a positive note, right? And like see if they work with them versus just fire them and give up, right? You could also say, what have you noticed makes a really successful new grad in this program? What qualities make new grads really successful in this program in your experience? Yeah, I feel like all of those work. Any other questions you wanna talk about before we wrap up? I feel like you're more confident this time. Your answers are more filled out. Make sure after you end your answer confidently that you don't go back in another circle because you're like, am I finished? Can I finish yet? Maybe I'll,
Mm-hmm.
like just end it confident and you really
Yes.
need to
Mm-hmm.
smile. It's literally going to make the difference of whether they choose you or not. Try to smile.
Really?
Yeah. Yeah, because everyone has good answers. You need to be the person they connected with, you know?
Okay.
There's
Mm-hmm.
sometimes you like laugh a little bit to yourself here and there, and I do that. I'm like, I hope she does that during the thing because it's great. It shows that she's like not just serious, she's also fun to be around. You know what I mean?
Oh my God, it's like just those interviews like drive me crazy. Just give me the job, any job, and it's
Oh my
okay. I'll
goodness.
handle it, hopefully.
I think your main goal now, because you have a good answer for every single question I give you, your goal now needs to, and you're gonna laugh at me when I say this, but your goal at this point is to enjoy that 30 minutes. Enjoy
Oh,
talking.
enjoy. Oh,
Like if
that's
you
a
have
good
a good time, which I know sounds ridiculous because it's like it feels like they're interrogating you, right? But like it's
Yes,
just a conversation. Enjoy that 30 minutes, that hour, and they're gonna be like, ah, our patients are gonna love her.
hopefully.
Yeah, that's
Okay,
your goal at this point.
okay.
Yeah.
Thank you so much. You helped me a lot, and I feel so much better.
Good, good. Let me know how it goes, okay?
Okay, thank you
Okay, have
very much.
fun.
Bye bye.